Welcome back to another's MemoMap, and today we are going to explore how Venus return changed during the exercise. But before this, let's talk about the general foundation of the vein, starting with the function and the biomechanic or biophysic properties of the vein. And starting with the functions, we found that the vein has two main functions, which is the TR. T stand for the transport, and R stand for reservoir. The vein is responsible for the transporting of the blood back to the heart. Regarding the reservoir, the vein can store blood with minimum change in the pressures, and this is due to the high compliance or capacitance of the vein, as we are going to talk about later on. So what about the biophysics or biomechanics? We are going to discuss two main important points, the compliance and the pressures in the vein, starting with the compliance. What is the compliance? The compliance is how much the volume change and for the given change in the pressures, simply the ratio of change in the volume to the change in the pressures, and it tell how the vessel expand when the blood enter to it. So comparing the artery and the vein, we can find that the vein has much higher compliance when compared to the artery. Why? Because of the wall of the vein, it's very thin, contain less elastic tissue, so it can stretch easily, while the artery has thick elastic wall, so it cannot distend easily. So the vein is like a soft plastic bag. You can pour a large amount of the blood in it with a minimum change or minimum increase in the pressures, while the artery is like the balloon. If you add a small amount of the blood, it will result in marked increase in the pressures. So the veins store large amount of the blood with a small increasing in the pressures. However, the compliance of the vein is not fixed, and it changed by the sympathetic stimulation. So when sympathetic activity increase, the smooth muscles of the vein contract, resulting in venoconstrict and increasing the venous tone. So the vein become less distensible and the compliance decrease. So sympathetic increase, the compliance decrease. Remember this. And let's see the diagram to understand this more. As you can see from the diagram, in the artery, when the volume increase from 1 to 1.5, the pressure jump from 0 to 40 millimeter mercury, and this is mean that the artery has low compliance due to the high elasticity compared to the vein. When the volume change from 1 to 2, the pressure rise only 1 millimeters mercury, and this is due to the high compliance, and this is could be explained by the thin, less elastic wall. Let's move to the second important point in the biophysics or mechanic of the vein, which is the venous pressures. And there are two key venous pressures we are going to talk: central venous or the right atrial pressure and the mean systemic filling pressure. And let's compare them one by one, starting with central venous pressures or the right atrial pressure. First, remember this normal value. The right atrial pressure equals 0 to 2 millimeter mercury. And why this is important: central venous pressures tell us about two important things. First, how effectively the heart is pumping the blood, and secondly, the blood volume status. So clinicians use this part to assess the venous patient circulation, whether the blood volume or the heart, and what are the factors that affecting the central venous pressures. Mainly three factors: the cardiac function, the blood volume, and the venous compliance. And let's look at each of them. First, the cardiac function with patient in a heart failure, the ventricle cannot pump the blood effectively, so it cannot empty. As a result, blood begin to accumulate behind in the right atrium, and this will result in increasing in right atrial pressures. Next, moving to the blood volume, the relation is straightforward. The total blood volume increase as in the volume overload or renal failure, so the amount of blood returned to the heart increase, and more amount of blood enter to the atrium, so the atrial pressures increase. On the other hand, if blood volume drop as in the shock, the right atrial pressures will fall. Finally, the venous compliance. When sympathetic increase, the venous constricts, become less compliant, and then it cannot accommodate the same blood as easily as before. So the venous pressures increase, and this will push more blood back to the heart, and this will increasing the right atrial pressures. So remember, the better cardiac pump, the lower right atrial pressures, the more blood, the higher the right atrial pressure, the low venous compliance, the higher the right atrial pressures. Let's move to the mean systemic filling pressures, the value 6 to 8. Also remember this normal value. Unlike the central, the mean systemic is mainly physiological concept, and it's not measured in the clinic practice. It defined as the pressure through the systemic circulation when the heart stopped pumping and the blood flow stopped. So why this pressure is important? Because this represents the driving pressure for the venous return. In other words, this is pressure that pushes the blood from the systemic circulation back to the right atrium whenever the flow is resumed, and it depends on two main factors: the volume and the venous capacitance or compliance. So if the blood volume increases, the mean systemic filling pressures will increase. In contrast, when the vein become more compliant, so it store large volume of blood without much increase in the pressures, so the mean systemic pressures decrease. So remember, the relationship between the mean systemic filling and the blood volume is direct, while with the compliance, the mean systemic and the compliance are inversely. It's time now to bring everything together by speaking about the venous return. Okay, the venous return, we are going to talk about the three main points: the definition, the equation, and the curves. Starting with the definition, the venous returns simply is the volume of the blood returning back to the heart per minute. So under the normal resting condition, the venous return is 5 liters per minute, similar to the cardiac output. So why the venous returns equal to the cardiac output? Because the amount of blood returned to the heart must equal to the amount of the blood pumped out of the heart. Okay, so what about the formation of equation for the venous return? It's simply similar to the flow equation. Remember, the flow equation is equal pressure gradient over the resistance. So when apply this to the venous system, the venous return equals the pressure gradient, which is the mean systemic filling pressure minus the right atrial pressure divided on the resistance to the venous returns. And to understand each part of this equation, remember that the mean systemic filling pressure is the driving pressures. It is the force that pushes the blood from the systemic circulation towards the heart, while the right atrial pressures is the back pressure. It represents the pressure at the destination where the blood is trying to enter. The blood is trying to enter at the end to the right atrium. So the blood move according to the pressure difference between the 2 points: the peripheral circulation, point 1, the right atrium, point 2. And finally, the venous return, of course, opposite to the resistance to the venous return. So remember, according to this, to increase the venous return, all you have to do is increase the mean systemic filling pressure and decrease the right atrial and decreasing the resistance to the venous return. So keep this in mind. Now let's look at the curves. First, the venous returns curves. The curve shows a relationship between the right atrial pressures and the venous return. As the right atrial increase, the venous return decrease. So it is an inverse relationship. Okay. But here it is important to know that we have two important points. First, the intercept with the x line, and this represents that the venous return equal 0. Why? Because the mean systemic equal the right atrial pressures, so there is no pressure gradient, so no force to drive the blood back to the heart. Accordingly, the x-intercept represent the mean systemic filling pressures. And the second point is the plateau. And the plateau, when the right atrial pressure fall below the minus 1 millimeter mercury, the venous returns will not increase further. This is mainly due to collapsing of the vena cava, so no further increasing in the blood flow. So now, what about the mean systemic filling pressures effect? And to study this, we will use the same previous curves, and here we will changing the mean systemic by changing either the blood volume or the compliance, so increasing the mean systemic filling pressure by increasing the volume or decreasing the compliance. We find that the curve shift up to the right, and noticed that the x or interceptions point here move because we changing the mean systemic filling pressures, so the value here need to be changed, and if we are going to decrease the mean systemic by decreasing the volume or increasing the compliance, this decreasing the blood volume or increasing the compliance or the capacitance, this will make the curves shift down to the left. So at the same right atrial pressures, the value of the venous return will decrease than the normal curves. And the intercepting point also move because the mean systemic filling pressures is changed. What about the resistance to the venous return? Also, we are going to use the original curves, and here we are going to keep the right atrial and the mean systemic. Look, the intercept point does not move, and here it is important to differentiate whether the change in the curves is due to the mean systemic or the resistance. Only the slope here of the curve change, so if the resistance increase, the slope will decrease. The venous return value will decrease, and at the same right atrial pressures. And opposite occur if we decreasing the resistance to the venous return, the slope will increase, since more venous return will returning to the right atrium, or more blood will return to the right atriums. Now reach to the final part for today's memo map, and here we are going to talk about the interaction between the cardiac output, which we discussed in previous videos, and the venous returns, which we discussed in this video. So if we put both of them on the same graph and see if both interact or not, we can find that both curves, when they are superimposed, the cardiac output and venous return both intersect at point A, and this point A is represent a steady state equilibrium, which mean that the cardiac output equal the venous return, so both equal 5 liters per minute. This when the right atrial pressures equal 0. So now let's change one variable and see what will happen. Imagine if you give the patient a positive inotrope drug that increasing the contractility of the heart, but with no direct effect on the blood vessels. So before looking, I would ask which curve should change, cardiac output, venous return, or both? The answer only the cardiac output, because we didn't do anything to the peripheral vessels. So the drug act on the heart, the heart can pump more blood, and the slope of the cardiac output will increase while the venous return curves remain as it is unchanged. So the equilibrium move from A to the B and the cardiac output increase but slightly. Okay, so why it does not increase largely? Because now the heart is able to pump more blood, but the amount of the blood that's returning to the heart is not changes. What about the exercise? As you can see, in during exercise, the pulse curves are changes. The cardiac output slope increase, the venous return shift up to the right. Since the exercise affects the entire cardiovascular system, the heart is affected, increase the heart rate occur, increase the contractility with decreasing the afterload, and this shifts or increasing the slope of cardiac output. The venous return shift up to the right due to the increased mean systemic filling pressures by the sympathetic venoconstriction. Also, the resistance to venous return decrease due to arteriole dilatation by the metabolite. And also, don't forget that we have skeletal muscles pumps that pump the blood back to the heart. What about the intersection point? It moved from A to the C, and as you can see, the cardiac output here increased markedly. So this means that to increase the cardiac output much more, it's important not only to act on the heart, but act on the heart and the peripheral vessels so that the powerful heart still can pump more blood. So the powerful heart still need an adequate blood supply. So for the great increase of the cardiac output, remember that you need to increase the heart activity as well as the peripheral circulation. Both should work together. And with this, we reach to the end of MemoMap today. Let's recap together what we started today or what we talked about. First, we are talking about the venous return change during exercise. We talked about the two main functions, which are the transport and the reservoir, storing a large blood volume with a little change in the pressures. Then we move to the biophysics or biomechanics, talk about the compliance and pressure. Regarding the compliance, is change in the volume with in relation to change in the pressures. The vein has more compliance than the artery. This means accommodate large volume with little change in the pressures. It's not constant. It changes by sympathetic stimulation, which constricts the vein, decreasing the compliances. Then we talked about the two important venous pressures, which central venous pressures and the mean systemic filling pressures. The CVP or right atrial pressure is 0 to 2, and it indicates the cardiac pump ability and the blood volume status. It's affected by the cardiac function, blood volume, and venous compliance. The second pressure is the mean systemic. It's 6 to 8 millimeter mercury. It is a physiological concept rather than routine measured in clinical practice, and it is driving pressure for the venous return depending on two factors, blood volume and the venous capacitance. Remember that the blood volume and the mean systemic filling direct relate. Venous compliance and mean systemic are inverse relate. Then we discuss the venous return curve, which is the volume of blood returned to the heart per minute, and normally equal 5 liters per minute. And the equation is venous return equal mean systemic minus right atrial divided by resistance to venous return. And the only direct relation is between the mean systemic filling and the venous return, while the others factors are inverse related. And then we apply this on the venous return curves. First, the curve is the relationship between the right atrial and the venous return. It's inverse, and there's intercept point in which the venous return equals 0 when the right atrial equals the mean systemic filling pressure, and other point is the plateau when the right atrial pressure falls below the -1. And next we saw that the changing in the mean systemic filling pressure shift this curve either up to the right or down to the left according to the increase or decrease in the mean systemic filling pressure depending on the blood volume and the compliance. Remember that whenever the mean systemic filling change, the x-intercepting intercept change as well. Then we look at the effect of the resistance to venous return. Increase the resistance, make the the slope of the curves decrease, while decreasing the resistance make the slope become more increased more, and the intercepting point remain unchanged. It does not move because the mean systemic filling pressures is fixed. Finally, we put everything together, the cardiac output and the venous return curves, and both intersect at point 8 under the normal steady conditions, in which cardiac output equal venous return equal 4 when the right atrial pressures equal 0. With a positive inotrope, we found that only the cardiac output shift upward, and the equilibrium point moved from A to B with a little increase in cardiac output during the exercise. Both curves changed simultaneously. The cardiac output slope increased due to increased heart rate contractility and decrease afterward. The venous return curve shift up to the right, and this is due to increase in systemic filling pressures, decrease the resistance to the venous return and the muscles pumps. So the equilibrium point is C, and here there's increase in the cardiac output when we compare to the previous curve. So the heart and the blood function as one integrated system, and for maximum cardiac output to achieve as in exercise, the heart pump more effectively while the circulation simultaneously returning more blood to it. Thank you for joining us today. See you in next episode.